Hello and welcome to session 23 of the medical debate, where we'll be discussing pregnancy. So firstly, we're going to go over an introduction to pregnancy. So how do embryos form? First of all, an embryo is formed when a sperm cell fuses with an egg released from the ovary, and this forms a fertilized egg cell. This will then travel to the uterus via the fallopian tube, where it will implant itself into the uterus lining, and the uterus will develop into an embryo and eventually a baby. And we've got an illustration here on the side of the slide showing how this fetus will develop while it's in the womb from a fertilized egg cell. Pregnancy can be split into 3 trimesters, and this is an idea we'll come back to later on in the session. There are 3 trimesters of pregnancy, which encompass the entire 40 weeks of pregnancy. The first 1 to 12 weeks make up the first trimester, and this is where the fetus begins developing their brain, spinal cord, and organs, and the heart begins to beat. The digestive and reproductive systems also start to develop, and the probability of miscarriage is highest at this point. The second trimester occurs during weeks 13 to 27, and this is where the fetus is checked for any developmental abnormalities, usually via an ultrasound scan. And the sex of the baby can also be determined at this point. Hair, muscles, and bones also begin to grow. So this is the stage where most of the development occurs in the fetus and most of the major organs start to develop. In the third trimester, which is weeks 28 to 40, the bones are fully formed and the baby can open and close their eyes. The baby gains most of their weight and are usually fully grown by week 37. And at this point, the birth will usually occur. And these are some more diagrams which illustrate how pregnancy occurs and the development of the baby during the 3 trimesters of pregnancy. We're going to talk first about smoking and alcohol and the effect this can have on pregnancy. I'm sure you're already aware that these can have very adverse effects on babies, and this is now a major risk factor and something which is very much discouraged among pregnant women. Firstly, in terms of smoking, smoking while pregnant has been linked to an increased chance of miscarriage, premature birth, and breathing problems. Nicotine can have a drastic effect on the baby's lungs and brain as well. Alcohol can be passed through the placenta and can cause premature birth or low weight in babies. Babies are also at risk of fetal alcohol syndrome, which is a condition that can lead to learning difficulties, poor social skills, and problems with hearing or eating. Children may need medication or special educational support for their entire lives if diagnosed with FAS. And here are some diagrams which illustrate the effects that fetal alcohol syndrome can have on a child. We can see from the diagram on the left that there are many physical abnormalities that can occur, which includes changes to the eyes and the shape of the nose, and undeveloped jaws and ears as well. And we can see on the right that there are several abnormalities which will occur in the brain itself, which can mean that children or people who are diagnosed with this syndrome will have difficulty learning and processing information. These disparagements include language skills being affected, poor memory, poor regulation, poor cognition, and attention. And this will undoubtedly affect their academic achievement and potential to have a happy and healthy life. We've got an example now which we're going to go through and try and apply in an ethical setting. So I'm just going to read it out loud and then we'll discuss it a little bit. One of your patients, Julia, aged 29, is in the 3rd trimester of pregnancy. She tells you that the pregnancy was unplanned, but she did not want an abortion. Her husband and the father of the child passed away a month ago from a heart condition. Julia tells you that she still drinks alcohol regularly, and this helps her cope with the situation. When you tell her about the potentially disastrous effects this could have on her child, she tells you that her sister drank during her pregnancy and her son turned out fine. You recommend some specialist alcohol advisors to her, but she becomes angry and tells you that she does not want any help. So this is an example which isn't uncommon in the medical world, and unfortunately many people will still drink alcohol during pregnancy for a variety of reasons, but as we've seen before, this can have several adverse effects on the baby. So whilst you're watching this, just think about what you would do if you were the doctor in this situation. You've already recommended some specialist advisors, but she says she doesn't want help and she's quite adamant about that. So would it be ethical to just allow her to drink alcohol and go ahead with the pregnancy, which could potentially damage her baby and damage her own health as well? Or would it be ethical for you to try and force her to stop having alcohol? So I think we can see immediately that these ideas can come into they can clash with the four pillars of medical ethics. And autonomy is the major one here. Should you allow a patient to have their own choice about the treatment they're receiving, or rather the lack of treatment they're receiving, or should you do what's best for the patient or what you think is best for the patient in order to have a better outcome for them, and in this case, their child as well? If we look at this from an autonomy point of view, I'm sure it's clear that the choice that you make or the choice she makes is what's being considered here, whether you allow her to have her own free will in this situation or not. If we look at beneficence, it's talking about what's best for her and what's best for her baby. And obviously, drinking alcohol will not be good for her or her liver or indeed other organs, and it might affect her baby as well. And there's a similar argument for non-maleficence as well in terms of harming baby. And the final pillar is justice. You could argue that in terms of justice, it's a doctor's duty to treat all patients equally, and therefore you're disparaging the child's healthcare or their health and not allowing them to have a full quality of life by risking damage to them. But at the same time, perhaps providing treatment to this mother might mean that other people aren't able to access similar treatment when it's quite clear that this mother doesn't want to receive this treatment. So there are several arguments you could make for that pillar, but hopefully you understand now how situations like these don't necessarily have a clear answer, and there are many different points that doctors have to consider when trying to treat patients, especially if they don't want to receive that treatment. We're going to talk a bit about abortion now, which I'm sure you've come across before. This is a very commonly asked question in various interviews for medical school, for example, and it's something which is still being heavily debated today. As I'm sure you're aware, an abortion is a procedure to terminate a pregnancy, and it can be carried out by taking drugs or through surgery. Abortions can they can usually be carried out up to week 24, and this is during the second trimester of pregnancy. In the UK, abortions are legal, but they can only be carried out under the following circumstances. Firstly, if there is a risk to the mental or physical health of the mother, either due to the pregnancy itself or the consequences of having a baby, or that there is a risk that if the child were born, it would suffer from physical or mental abnormalities as to be seriously handicapped. So essentially, abortions can only be carried out if there is a danger to the mother or a danger to the child. And in order to avoid these dangers, terminating the pregnancy would be a possible solution. So we've got another example here, which we're going to talk a little bit about with regards to abortion and whether or not you think it's ethical to allow the abortion to occur in this situation. So one of your patients, Megan, aged 15, has recently come into your clinic having received a positive pregnancy test. She is 12 weeks pregnant. She tells you that she had a relationship with an older man who cut contact with Megan after discovering she was pregnant. The pregnancy was unintended, but the pair did not use contraception. Megan's parents are upset with the news, but tell you that they will not allow her to terminate the pregnancy. As devout Catholics, they believe abortion goes against their religion. When the parents leave, Megan becomes upset and tells you that she doesn't want to have to take care of the baby whilst in school. Megan also tells you that her parents have threatened to disown her and kick her out of the house if she decides to terminate the pregnancy. You believe Megan is competent to make a decision herself. By UK law, girls aged 13 and above can legally obtain an abortion without their parents' consent. So we've got a lot of information here. And again, this is a situation which, although maybe not common, is very much possible in a modern world, in a modern environment. There are people in the UK who are from a variety of backgrounds and therefore have a variety of beliefs. And therefore, it's not always the case that people agree on issues such as abortion. So firstly, we're going to ask you about what you would do in this situation. So let's think about the 4 pillars of medical ethics. And if you would like, you can pause the video at this point to have a think about the various routes you could take in this situation, the various options which are available for Megan, and whether or not these will follow the 4 pillars of medical ethics. So perhaps pause the video at this point and perhaps take out a piece of paper and write down under each of the 4 pillars a possible route of action and discuss whether you think these are ethical or not. So hopefully you've had a chance to pause the video and have a think about this question. So let's take a look at it and have a think about it from the point of view of the 4 pillars. So in regards to autonomy, first of all, this question is again very much based around autonomy and doing what the patient wants. And there's a clash here between what Megan wants and what her parents want. We know that Megan did not intend for the pregnancy to happen. The pair did not use contraception, but since Megan is very young, it's likely that she might not have known about the importance of contraception. She is clearly quite naive at this age, and although not her fault, she has clearly made a mistake by having this relationship. And she clearly does not want to go ahead with it. She's too young and she is very upset about it. She's still in school, and therefore from her point of view, having the baby is not something she would like to do. However, we know that her parents in this situation have very opposing views. We know that they are Catholics, the abortion goes against their religion, and therefore for them that's not an option, and the only option for Megan is to have that baby. However, a possible solution to this clash is that although Megan may be able to have the baby, but perhaps give it up for adoption, or it can be put into foster care, that is a solution that could be discussed with Megan by the doctor, because that would allow Megan to have the baby and to not terminate the pregnancy, whilst at the same time not having to take care of the baby when she's still not ready. But at the same time, some people might argue that as a 15-year-old, so as a girl, essentially she is not ready to go through a pregnancy yet. So that's a counter argument there. So that's from the point of view of autonomy. Now, I should point out that, as we can see at the bottom of this case study, by UK law, girls aged 13 and above can legally obtain an abortion without their parents' consent. And therefore, in this situation, if this were a real situation, Megan would be able to obtain the abortion regardless of what her parents think. And if it was her will to do that, then the doctor would go ahead with that course of treatment. From the points of view of beneficence and non-maleficence, again, with abortion, there's always the argument that terminating a pregnancy will potentially end life, and there are opposing views on this, but that's one argument that could be made in terms of damaging a life, a potential life that could be born. But then again, it could also damage Megan's life. We know that she's very upset about it. We know that she's clearly not ready to go through the stress and financial burden of having a child, despite her potentially being supported by her parents. She's clearly not ready for that, and therefore that would have a massive impact on her life and her prospects for the future. We also know that perhaps if she did decide to go ahead with it, she would be kicked out of the house by her parents, and that again would have a very negative impact on her. From the point of view of justice, justice regards treating all patients equally, and again, in this situation, you are trying to treat, try and take into account Megan's views while also respecting her parents' views. But at the end of the day, it would be Megan whose views are responsible for her course of treatment overall. So hopefully you would have thought about these points that I've just mentioned and perhaps come up with your own ideas or your own solutions to this problem. Um, I think in this situation, what would be expected by a doctor is to discuss it thoroughly with Megan and her parents together, try and really establish what each party wants and why they want it. And perhaps if it's Megan's decision not to have the pregnancy, not to go ahead with it and to terminate the pregnancy, then explain to her parents why it might not be such a bad thing, and persuade them that perhaps they should support Megan, and explain the advantages to Megan of terminating this pregnancy, despite it not this going against their religious beliefs. We're going to discuss another example now regarding abortion, and this is to do with a same-sex couple and a surrogate mother. So I'm going to read out the case study and we'll discuss it a little bit in a minute. So Daniel and Rashid are a same-sex couple who have asked their friend Anna to be a surrogate mother for their child. Rashid provided the sperm sample and Anna provided the egg, which was fertilized via in vitro fertilization, IVF. The embryo produced was implanted into Anna's uterus. An ultrasound scan during the second trimester revealed that the child would have a very high risk of developing cystic fibrosis. People with this condition usually only live to their mid to late 40s and will experience breathing difficulties and regular pain. They will need medication and treatment throughout their lives. Anna wants to terminate the pregnancy. However, Daniel and Rashid both want to continue with it. The couple tell you that they are able and willing to pay for any treatment the child will need. So this is a similar situation, similar to the last slide, where there are two parties who have differing views on the termination of a pregnancy. So I'd like you to pause the video now perhaps and have a think about what you would do in this situation were you the doctor, and try again to keep in mind the 4 pillars of medical ethics and how they will affect your decision. So please do pause the video at this point and have a think about that. Okay, so hopefully you've had a chance to pause the video and think about this case study a little bit. So as we can see, the main argument here is who is responsible for deciding whether a pregnancy is terminated or not. Should it always be the mother's responsibility or the mother's decision, even if that mother is not going to be raising the child or is not responsible for that child's upbringing and care? Because in this case, we know that Daniel and Rashid are the couple who are taking care of this child, who will raise this child. It will be their child. So some might argue that it's not Anna's responsibility, or it's not her decision to be made as to whether this child should be born or not, since she is just allowing the baby to be born via her uterus, because obviously Daniel and Rashid are unable to have their own child in this way. However, some people will argue that abortion is a woman's choice, and a woman's choice only. There should be no other party involved, and that it should just be Anna's decision alone in this situation, because she is carrying the baby, and therefore, since it's her body, it's her choice as to what happens to it and which course of treatment she decides to undergo. Now, an important thing to consider here is beneficence and non-maleficence. We know that the child will develop cystic fibrosis, which is a very it's a very painful disease, and it's a disease which does cause a lot of damage to the people who live with it and their families as well. However, we know that Daniel and Rashid do want to care for the child. They are willing and able to pay for any treatment the child would need. And many people who do have cystic fibrosis are still able to go on to lead perfectly healthy and happy lives, although they will need care, and they will most likely experience difficulties. They are able to have completely fulfilling lives, still go to school, receive an education. It is very unfortunate that they don't live as long in general as people who do not have the condition. But that does not mean they cannot have a meaningful life. And as we know, Daniel and Rashid are fully prepared to provide their child with that life. So this is the argument we have here in this situation. And hopefully you've had a chance to think about it from the point of view of all four pillars of medical ethics. Now, in real life, this is a difficult situation and there is no one solution to it. It is, in this country, the woman's choice as to whether she wants to terminate the pregnancy or not. It will be Anna's choice. However, a doctor will most likely take into account the views of Daniel and Rashid, and they will most, if it is not the will of Daniel and Rashid to terminate the pregnancy, then doctors will most likely consult Anna and really try to establish her view on the situation, taking into account the fact that it is not her child necessarily who is going to be brought up. It is Daniel and Rashid's, and their opinion should definitely be encouraged to be looked at and should definitely be taken into account. Although the final say as to whether the pregnancy should be terminated or not should definitely be Anna's and Anna's alone. That is what would happen in this situation. Right, so we're going to discuss a couple of interview questions now, and these are interview questions which have come up before in a variety of interviews in various forms, and they do link very heavily to the examples we've discussed before. Firstly, who should decide whether a woman receives an abortion or not? Should it be entirely up to the woman herself, or should her partner's opinion be taken into account? And also, should children need the approval of their parents to have an abortion? These link to the case studies we've just discussed. Some people are very strongly supportive of the idea that it is a woman's body and her choice, and therefore it should not be anybody else's idea. It should not be anyone else's place to limit women from having that choice to terminate their pregnancy. But some people believe that if a woman is not directly involved in the upbringing of a certain child, as we saw in Daniel and Rashid's case, it shouldn't be her choice, or perhaps her choice should be complemented by the arguments of the couple or the party involved in raising that child. And also, should children need the approval of their parents to have an abortion? Children do need their parents' approval in many situations, and indeed children's rights are restricted on many issues. And indeed, having a child is a very big decision to be made. So, and some people would argue that a parent's judgment is needed in this situation. But then again, if we are thinking about my body, my choice, and the kind of idea that people should be entitled to their own opinions about their own bodies, then that goes against this idea that children should need the approval of their parents. And of course, in this country, children under 14, or rather children over 14, are not required to have the permission of their parents to have an abortion. The second question we've got up here is, are abortions ethical? Are abortions themselves respecting the four pillars of medical ethics? And this is a very big issue that is still heavily debated today. And many of the considerations that people have with regards to abortion are based on religious morals, which can, of course, be interpreted in many different ways. Now we're going to talk a little bit about home births, which is a somewhat controversial issue, but it is more or less widely accepted in the UK. A recent study suggested that home births could be as dangerous as driving without putting your child's seatbelt on. And this is due to households not being equipped with specialist staff and equipment in case of an emergency. So we've got a case study here, which we're going to again read through and discuss. And yes, so I'll just read it out loud and then we'll think about it a little bit. Dwayne and Florence are a couple who visit your clinic. They're expecting a baby and ask you if it is safe for them to have a home birth. You tell them the risks of having a home birth, and they tell you they would like to go through with it. A week later, they come back with their baby daughter. They tell you that she developed a fever after she was born and was refusing to feed. You realize that she has an infection and immediately start to treat her, knowing that the damage could be severe. although you managed to keep her alive, you realize that she may experience lung issues while growing up. You believe that this could have been prevented if the baby had been born in a hospital and given treatment immediately after birth. So this situation is extremely uncommon, especially in the UK, where medical services are very accessible for most people, especially regarding the fact that we have a universal healthcare system, the NHS. However, it is very much possible for there to be complications in home births due to medical facilities not being close by, and there is an increased chance of emergencies. Um, so, although unlikely, it's important to consider situations like these. The first question we want to ask is, who was responsible for the baby's condition, if anyone was? Was it Dwayne and Florence's responsibility? Is it their fault that the baby had this condition? They were aware of the risks, or is it the doctor's fault? Should the doctor have said, no, there are too many risks, you should have a birth in a hospital? Some might argue that it's neither party's fault and mistakes do happen. There are emergencies and there are situations where things go wrong, and that was the unfortunate case in this situation. And secondly, we want to ask whether home births should be illegal, considering their risks, considering that they are a slightly risky option. Now, most people will most likely disagree with this. They will think that, with regards to autonomy, mothers should be able to decide what their treatment is and therefore where they want to have their baby. But of course, there should be more education regarding the risks of home births as well. But all in all, home births are generally considered to be fairly safe. But of course, they do have an increased risk than hospital births. So we've got a couple of other ethical issues which we're going to briefly discuss before we end the session. So firstly, if a mother is in a critical condition and only her or her baby can be saved, which would you choose? Now, this is a very vague question. And of course, if this were a real life situation, there would most likely be a variety of factors that a doctor would consider, including perhaps the age of the mother, the condition of the baby, and whether they have a chance of surviving after being born, and also how easy it is or the likelihood of saving either party. And of course, we've looked at futility in a previous session. If there is a low chance of saving the mother, but a high chance of saving the baby, then perhaps it might be more medically practical for the doctor to choose to save the baby. So this argument has points on either side, but please do try and think about what your opinion is on this situation, and please do leave a comment down below if you do have a particular view. And the second question we've got is it ethical for pharmaceutical companies to carry out drug trials on pregnant women? And this links directly to the thalidomide scandal, which took place a few decades ago, and it did cause quite an uproar. And it was to do with pharmaceutical drug trials with a certain drug which caused severe deformities and disabilities in children, as we can see from this photo. And that was that caused quite a public outrage, and many people after that believe that pregnant women shouldn't be tested on in any situation due to the risk that it could pose to their children. So, of course, many people will argue that when there is a risk like this to unborn children, there should never be any pharmaceutical trials carried out. But other people will argue that in order to advance our medical technology, our drugs, and our treatment for pregnant women, we will, of course, need to carry out these trials to ensure that they are safe and effective. So that's the ethical argument we have there. Please do, of course, comment down in the comments down below about what you think on this situation and whether you have a particular view. So that does bring us to the end of our session. Thank you very much for watching this video, and please do email us on themedicaldebate@gmail.com if you have any further questions, or to be added to our mailing list as well, where you'll receive the link for any future sessions. please do DM us as well on Instagram at The Medical Debate, and please do follow us there as well to keep up to date with any of our future sessions and our guest speakers as well. Thank you very much for attending this session, and please do come again soon. Thank you very much, and goodbye.